Black Doctors podcast highlights the stories of minority professionals with the goal of inspiring others. Season 2 provides more episodes and features a wider variety of professions. If you like what you hear, please subscribe and share with others, because the next generation can't be what they don't see. Tune in every Monday to hear our stories told by us.
Hello and welcome back to the Black Doctors podcast. This week, I'm honored to be sitting down and talking with Dr. Danielle Hairston. She's a psychiatrist practicing in Washington, D.C., and she is the program director for the Psychiatry residency program at Howard University Hospital. She was also my resident when I was a medical student studying at Howard University College of Medicine. Dr. Harrison, thank you so much for joining us.
Well, thank you, Dr. Bradley Stephen. I'm very proud of you now that you're on the other side. So thank you for inviting me.
I have really enjoyed watching your career blossom and seeing you in this position of leadership and so much things that you're doing for the Black community and for those that suffer from mental health conditions.
Well, thank you. You know, it's challenging. It's challenging being in the community. It's challenging supporting the community, standing up for our students and our residents. But, I'm here for it.
As a psychiatrist attending physician, what is a typical day like for you?
So I guess I'm pretty atypical, so I don't have the typical day of a psychiatrist, I guess, in the traditional sense as what people really think about as a psychiatrist. And then you go to their office and it's an outpatient setting and you discuss your issues there. I primarily work in the hospital and I'm a consultation liaison psychiatrist, so that's a fellowship and boarded subspecialty of psychiatry. So I work everywhere, literally anywhere in the hospital, from the ER, the ICU, labor and delivery, all the medical floors, surgical floors. I even go down to dialysis sometimes to see any patients who have psychiatric conditions who are on another service and being treated by a different specialty, or those who previously didn't have a psychiatric disorder but have some type of psychiatric manifestations from their current medical condition, be that delirium, be that dementia, postpartum depression, psychosis, mania, things like that. So my day is not typical at all. I can tell you that it's always an exciting day on consults in psychiatry. So yeah, that's what I do.
Awesome. And how many patients do you see a day?
Oh man, it depends. Sometimes we could just have 4 consults. Sometimes we could have 12 or 14 consults. It really depends on the day, the time. Also, if I happen to also be covering my telehealth services now since the COVID-19 pandemic, I could possibly have 6 or 7 patients to see via tele, and then also cover the emergency room. So whoever comes in from 8 to 4 p.m.
Wow. And then is there a call component of that on the weekends, or how does that work?
Yes, there is a call. It really depends on where you work, particularly in my hospital, I'm on call a weekend every other month.
And then how do you work with your teams? You have residents on your service, medical students. How's your interaction with them?
Yes, I have a wonderful, outstanding, always learning consult team that's comprised of at least one psychiatry resident, could be 2, could also include a neurology resident, depending on who's rotating, could also include an internal medicine resident. And then I also have anywhere upwards of 2 to 5 medical students with me at a time. So I have a pretty big team.
That's awesome. And how long have you been in practice?
Well, I'm not new to this, but I grew to this. However, I'm a fairly young attending and probably the youngest psychiatry program director, definitely the youngest Black psychiatry program director in this country. But I finished residency in 2016. But so do we count residency and post-residency? Well, whatever. I finished residency in 2016, and so we're now in 2020. So 4 years of doing my own thing. I also did fellowship in that time and worked part-time as an attending as well.
That's
So
awesome.
yeah, about 4 years of independent practice outside of residency training.
Yeah, well, hard work definitely pays off.
Indeed, or so they tell me.
Yeah. And then speaking of hard work, so at some point Dr. Harrison was not Dr. Harrison. You decided to pursue this field in healthcare and in medicine. At what point in your life did you make that decision?
Oh man, I think that like I had like a top three when I was a little kid about what I wanted
Hmm.
to. On my list was a doctor, an ice skater, and a fish. But then I learned that it wasn't really possible for me to become a fish, and I really wasn't built for this ice skating life. So then I, narrowed it down to a doctor. And I also really wanted to do like I'm like into all like crime things, like true crime. So true crime stories, Law and Order,
Hmm.
CSI, all into that. So I wanted to either be a doctor or like a forensic scientist. But then I think it really was solidified for me when I realized that there's no black doctors in my family. And I did have one black pediatrician when I was a kid, so I knew that it was something that I could attain.
Hmm.
But I think that when I really realized there wasn't, and I think even my grandmother told me like, there's just aren't any, like she'd never seen a black doctor in
Wow.
her life. And I was like, this is, I think I'm more leaning towards the doctor side. So that's really how I decided on that. Also, my father would always say like she's going to be the first Dr. Hairston in our family, and unfortunately my father passed away because of a medical
Uh,
complication that could have been avoided. And that was when I definitely knew that medicine was going to be the specialty or the career for me.
wow. And that was before or after you started college?
So my father passed away my senior year of high school.
Wow. Sorry to hear that. So as you applied to colleges, where did you go to undergrad and what was your course of study?
I went to undergrad at Rutgers University in New Jersey, and at that time we had like different campuses. So I was on what they called like the Black campus, the which was Livingston College at that time, and I majored in biological sciences. I minored in Africana studies, which I guess that really defines who I am. I wanted to double major. However, with all my science classes, I missed the one class that I needed to finish the double
Oh,
major
no.
in Africana studies. So, yeah, that's what I did for undergrad.
And then towards the end, you were applying to medical schools. And how was that process for you?
So, applying to medical schools, it was a pretty actually good process because Rutgers had a program called ODASIS, which was dedicated to helping pre med and pre dental students prepare for applying to medical school, for applying to for taking the MCAT. So I was in this program since I was a sophomore, and we had like tutoring, weekly tutoring. We had meetings with our advisor. Dr. Khan was in charge of the program, who was from Trinidad, and would always tell us like, eat your books, sleep with your books. So we would be prepared. And then every single Saturday, I was in an MCAT prep class and course with, a group of other Black and Brown students. So yeah, that was probably the easiest or the most supportive part of my journey. Then I took the MCAT. I took the MCAT once. I was fine with my score. I applied to, I believe, 10 medical schools. I remember the first one that accepted me, even though on my interview they tried to come for me and said
Hmm.
they will remain nameless. They said, "Oh, I see you got a C in Bio 101." I was like, "Oh, we're taking it all the way back to 101." Did you see the rest of my grades? Okay. So I got accepted to 6 and then waitlisted on one of my medical schools.
Oh,
I
wow.
actually got accepted to and actually accepted the admission to another medical school, but then Howard called me and said, "We have a scholarship for you. What are you doing?" And where I ended up.
Yeah, they may not come when you want them, but they're always right on time.
Yes, that's the Howard way,
Yep.
indeed.
So you went to Howard University College of Medicine.
Yes.
And at what point did you decide on psychiatry?
So I was very late in the medicine game and how they expect you to know things and
Hmm.
what you want to do early. I came into medical school because of that program that I told you at Rutgers. I had shadowed infectious disease doc in New Jersey, and I decided that I wanted to work with HIV patients. That's where I saw there was a need. So I came into medical school saying I'm going to do internal medicine. I was on the internal medicine interest group. That's what I thought I wanted to do. Then crossed the bridge, and I was like, whoa, I don't know about this. The specialty that I really liked was psychiatry. I felt like I got to I got to do consults. I had some inpatient time. I felt like I truly enjoyed the psychiatry rotation. However, there's stigma in medicine. There's stigma in the Black community. I had
Yeah.
family members who told me that they wished that I didn't match into psychiatry. Even now, I have some family members who tell people that very proudly that I'm a doctor, but they don't say that I'm a psychiatrist.
Mm.
It was not until I think really ERAS time that I was like, I have to really make this decision for myself and where I feel like I want to be. So I applied to medicine, med psych, and psychiatry programs. And then I went on mostly psychiatry interviews. I had some struggles with step one. So internal medicine was not necessarily the most forgiving for
Mm-hmm.
that. And so I definitely got more psychiatry interviews and more empathy and support, I felt like, from psychiatry. My mentor was a psychiatrist. So yeah, in fourth year is really when I already knew in third year, but in fourth year is when I was like, no, this is what I have to do, no, despite whatever, regardless of whatever pushback or feedback that I get from others, this is what I want to do.
And now, fast forward a couple years, you went from psychiatry resident at Howard to being the whole entire program director. What has changed for you? Like looking back, what would you tell yourself when you were applying to psychiatry, or what would you say to other students that are considering that field?
Man, there's so much I could have said to myself back when applying, probably to allow myself some grace. Like, I spent a lot of time being unhappy and stressing about test scores.
Mm-hmm.
I think that dominated my medical school experience, and it really hurt me. And like, my confidence as a medical student was in the gutter, like it was trash. And I think and it truly was entirely because of the culture about these scores and how
Yeah.
important they are and what you can do and who you can be. And I wish that I, but I don't know what could I say to myself, because that is, again, the culture of medicine.
Mm-hmm.
What helped me was going to therapy, which I started going to therapy in medical school because of just my extreme test taking anxiety, my just generalized anxiety, period, which developed. I mean, I was always like kind of nervous ish,
Yeah.
but yeah, it became completely exacerbated and full blown in medical school. So I think maybe if I had gone to therapy earlier, like first year, MS1 or MS2, maybe I could have tackled these things. I think I would have told myself to just allow myself some grace and take care of myself first. But what Howard did bring me, which I appreciate now more than ever, is a strong network of friends
Mm-hmm. Absolutely.
that are really like my family. Even when I returned to Howard recently as faculty, like they're like, "Hey," like, it's just like a feeling that you can't remember. It's like some faculty were like, "When are you graduating this year?" I'm like,
Right.
"Pause, guys." Like, I'm a whole attending now. I mean, there are pluses and minuses, but I think really just like caring for myself should have been more of a priority.
Yeah, I think it's so important and so many lessons that we can learn along the way. And I mean, looking back, I definitely know I struggled with some lows and some highs in medical school to the point that I had some anxiety and probably some depression, definitely at times that I ignored.
Right, right. I think that we all do. I think that that's an unfortunate consequence of this field. I saw a post on Twitter last night that was like, "Why do I feel like taking off a day in medical school is illegal?" Like, and that resonated with me. I'm like, yeah, but that's not just in medical school. Like,
Right.
that's the culture of medicine and residency, in even being an attending for some of us, not all of us. Some of them live their best
Yeah.
life
Some.
and don't
Yep.
mind.
Some people have no problems.
No
Um,
problem.
with the current state of events, and folks are going to be applying to residency programs, and they're going to be interviewing. A lot of interviews are not in person; they're on Zoom or online. What tips or recommendations or things would you say to students that are nervous about this new normal for us?
So I know that students are nervous about this, and so are some program directors, but I'm actually excited about this because I think it's going to level the playing field.
Hmm.
We have we have a system in this country, but in this field of medicine that really favors privilege. And I think that if you don't have the funds to apply to all of these programs, if you don't have the funds to fly to this place in the past, to interview in these different locations, to travel here, to stay here, to find hotels or Airbnbs or whatever it is, you're at a disadvantage.
Mm.
So I think now that everyone has to, I don't know about other specialties, but for psychiatry, we have to only do virtual interviewing. Like now there's more opportunity for you to put yourself out there. And I think that if anything is a silver lining of this pandemic and this racial and social injustice, it's that people are, even if it's just performative or even if it's just for numbers of inclusion, are having to reconcile and examine their diversity and their number of URMs in their programs, and they're having to answer to that because the whole country is seeming like they have to answer to it. So I feel like this is the time that marginalized and URM students can really say, hello, I'm
Hmm.
here. Don't make any excuses. I'm not here for your coded language. And know that I am here on the back end, me, Dr. Harrison, pushing them every single time. Every time I hear anything, I'm like, what did you say?
Yeah.
What?
Oh, that's
So,
that's amazing. That's like actually a great way to look at it, and yeah, hopefully this cultural shift continues. And speaking of using your platform, because you are on Twitter at a doc named Danny. Did I say that right?
yes, I am on Twitter at a doc named Danny. Same thing for Instagram. It's funny that I had made a Twitter, I feel like in 2014 because of this community outreach program I had.
Mm-hmm.
And then I was like, this is not for me. But some of my colleagues said that, please come back and, tweet and join. Like, we need more voices, Black academic voices in medicine. And I decided to return, I guess, in 2019. And then really just in, I think, April of 2020, have a public Instagram because I'm pretty low key,
Yeah.
even though it appears that otherwise I'm pretty like low key and to myself. Like I could live in my room for the whole weekend, but I felt like it's important to have visibility, and silence keeps people suffering. So I want students, I want residents to know that we are out here. I've had students who said, literally, someone sent me a message yesterday that said, can I connect one of my students to you because she says she's never seen a Black psychiatrist,
Wow.
never met one or talked to one or anything. And I'm like, okay. So visibility is important. Even visibility is important. Sponsorship is important, but it is important that people can see us even out here on social media, just living our lives like what you do with the
Oh
podcast.
gosh.
You please. It's important that people can see us, and I'm serious. Like we can talk about pipelines, we can talk about mentorship, but like I said, growing up, I had a black pediatrician at Walter Reed, actually, because my father
Really?
was in the army. Yeah, and so I had a black pediatrician. And I had doctors who were very diverse. So it always was in my mind that it's possible because I saw her. But that was me and the opportunity that I had. Now, was that my opportunity because my father was in the military and I saw a physician that others didn't get to see? But the
Right.
visibility is important, showing young students, showing we need to go back to elementary, high school, that we actually exist, and this is something that if you're interested in, you can definitely achieve. You didn't even ask me that. You asked me about my Twitter. But yeah, that is why I have made myself more visible on the socials lately.
Well, I absolutely appreciate your visibility, and you tweet phenomenal stuff. I have a Twitter account. I don't really know how to use it efficiently. I'm like putting in typos when I respond, and then I can't edit what I
You
post.
can't delete them. It's very annoying. Like Twitter, at Twitter, please.
But I do share your sentiment. I'm very private and reserved, and literally came down to the point about a year and a half ago where I said, at what point am I going to feel like I've arrived, I guess, or I'm more confident as an attending physician that I can use a platform and I can have visibility and I can help other people. So that's kind of what my push has been as well. I mean, this podcast is an extension of that, but it's also a kind of a cop out because fortunately I have amazing guests that I let talk most of the time.
Well, you have arrived, and I think that's another thing. Like we think we haven't arrived. I don't know. I mean, I do remember. I think Dr. Bradley, you're 2 years behind me in medical school. But when I see you, I'm like, look at this guy out here saving the world, posting about it. Like people need to see this. You know what? I need to see it because sometimes I'm not motivated, and we all need to see each other. Again, that is what's priceless about an institution like Howard. Now, while we have struggles, while we have some differences in the availability or limitations on resources, what it is like to go to a HBCU, particularly for medical school, to
Hmm.
see Black physicians, like majority Black physicians and brown physicians, is something that I think that I can say I took for granted.
Yes.
And I had to learn from my friends who were at other medical schools who were like, can I come for your date auction? Can we
Oh
come?
yeah.
Can we come to the smoker? Like, when are y'all? I mean, like other, medical schools in the DMV. My friends who were like, because this ain't it. Like,
Right.
we need some diversity. We need something for the culture, and just having this network, being able to say like, oh yeah, I have a. If someone asks me something like, do you know a Black male anesthesiologist? I'm like, yeah, I can say that. Do you know a Black male or female or non-binary
Hmm.
OBGYN? Like I can say that, and pathologist, like I know who to go to, and I can say that because of my Howard networks and also um, from training in Baltimore with my Baltimore networks of just young Black physicians who are out here doing it. So we have to really give ourselves credit and
Hmm.
appreciate the shoulders that we stand on and the ancestors that and legends who have our back.
Absolutely. Yeah. You don't really know what you have till it's gone. I know leaving the Howard community was like, whoa, what is this world?
Exactly. It's a culture shock. And that for me, it came because, I did residency at Howard. But for me, doing fellowship, I was like, where am I?
Yeah.
Like, what is happening?
Speaking of social media and Twitter, one of your tweets that resonated with me recently kind of referred to the Elijah Wood situation, although there's other situations in which law enforcement organizations and medical services are administering ketamine to folks on the street. Your tweet reads, "I'm struggling with physicians, which are their specialty, who say that excited delirium is a medical diagnosis or condition. You say it's a term used by law enforcement officers to describe agitation and distress to justify the use of force, ketamine, and apparently spit hoods. Can you speak on that issue? It's something that's really affected me as I use ketamine a lot in my practice as an anesthesiologist. But when
Right. As
they,
an anesthesiologist, key word, as an anesthesiologist
yeah,
for pre and for pre surgeries, during surgeries,
hmm,
sedation, like you as a medical professional who is boarded, and licensed. Yes, you do.
yeah. What
Um,
is what is this excited delirium? I know I never heard of it before reading about Elijah Wood, but can you speak on that as a psychiatrist?
so excited delirium is actually not a diagnosis that's acknowledged by psychiatrists or in the DSM-5, which is our diagnostic manual. It's literally something that I feel like is an antiquated term that they have now morphed into a justification for using ketamine or force or sedation or Honestly, I've never seen this spit hood until I saw the case of Daniel Prude in
Mm,
Rochester, New York. And that was actually what inspired my tweet because have been articles that have talked about excited delirium. I hear some psychiatrists, also emergency physicians and pre-hospital teams like EMTs, and sometimes I don't know if you include law enforcement officers in pre-hospital teams, but using this term excited delirium, that's really, I don't know how it became this thing that it's a something that you use to describe severe agitation, which is in fact a symptom, which could be attributed to multiple
right.
different diagnoses. But delirium is definitely a diagnosis. There's hypoactive delirium, there's hyperactive delirium, there's intoxication. But what is excited delirium? And I've seen the term used for someone anywhere that ranges from someone who's not following directions and is mildly irritated to someone who might be experiencing psychosis or an acute drug intoxication. And it's interesting that excited delirium often results in death,
Right.
but it's associated with almost always some type of interaction with the police. Yeah, I'm not sure why we're continuing to use this term. It's not a medical term. Delirium is a medical term, and there is no clear definition on what excited delirium is. Nor is where is the evidence based medicine for using ketamine in the streets, not by you, Dr. Bradley, not by an anesthesiologist, but by an EMT directed by the police for this diagnosis that's coming from police officers of excited delirium. Like we really have to review this. There has to be some type of answer to this. And this controversial diagnosis, it can't be given by untrained non-medical professionals. I don't get it.
Yeah. Well, thank you again. This is why we need your voice on Twitter and social media, and we need to hear from people that look like us, and we can affect change.
Well, know that even as recently as this morning, I've gotten messages, I guess also because of that tweet from Black forensic psychiatrists, just general psychiatrists, and pathologists who are going to work on something. Black physicians are going to work on some type of actually evidence based or literature review to really delve into what this is and how we got to this. But first of all, I know how we got to this, but
Hmm.
what is the answer and how we can move from using this as a derived term that has been morphed and twisted from something that they used to use in like the 1800s.
Yeah. Well, I'll definitely be looking forward to hearing more on that issue from those folks.
Me too.
Being a black physician and being a psychiatrist specifically, you kind of touched on this earlier. There's such a lack of understanding in our community when it comes to mental health issues. I know a lot, or it seems to me like a lot has changed over the last 5 or 10 years when it comes to mental health in the black communities. What would you say is the state of affairs with mental health and mental illness in the black communities?
I think that there remains a stigma about mental health and seeking mental health care, and there are many reasons for this. We are not without history. We are not an ahistoric people, and we have been dealing with multiple issues with specialties, with physicians from different specialties, but including psychiatry going back to even in the time that our parents have been alive about being diagnosed with psychotic disorders if you protest. Jonathan Metzl has a really good book called The Protest Psychosis that describes how schizophrenia became a diagnosis for black males who were perceived as angry or aggressive and protesting or refusing to comply
Wow.
with law enforcement, with physicians, whoever it is. So there's that. There's also the lack of physicians, psychiatrists who look like the communities that they serve.
Hmm.
Less than 3% of psychiatrists self-identify as black. So
Wow.
They don't see people who look like them. They don't see people who look like them talking about this. Someone in their family might have been wronged or misdiagnosed by the field of psychiatry and other mental health providers. So there's that taboo. There's a taboo of not that taboo or stigma. There's a stigma of not wanting to seem like you're weak or you're crazy. And that's something that I even have to discuss in my own family. Like, we're not going to call people crackheads, everyone. Like, people and my literally like my sister, my best friend, my boyfriend, everyone is like, "Oh, here she goes." I'm like, "Yes," because terminology is important. The language we use determines how things are perceived, and things are swept under the rug or are addressed with substance use, or you say you don't want to talk about this, or you don't want to talk about your business out in the street or with strangers. Like, you feel like this is something that families can deal with themselves, and it actually ends up hurting you until we see Black and Brown Latinx patients as well who are not whose issues are not addressed early because of, as I just highlighted, multiple different reasons, but also because it takes a long time for us to get to care. And you might be in an emergency situation or setting in which sometimes the police are involved. So you just see how it's just like a repetitive cycle here. And it sometimes seems like we can't win. If anything, though, I can say that you said the last 5-6 years. I'm going to say the last 5-6 months. I have heard more people talking about their mental health issues. I've seen more posts about that. You saw Michelle Obama discuss even how she has been experiencing some, what does she call it, low grade depression. So I think the conversation is happening more. I think people have more screen time, so they're literally screen and podcast time. They're literally talking about it and listening about it more. And I feel like I've had way more like DMs and texts like, "Can you help me with this?" Even from my family members, friends, colleagues, like people I went to high school with who are like, "Can you help me with my family member? Do you know what I should do for this? Like, I'm suffering, I'm struggling." And I appreciate, well, I guess I appreciate that this terrible time that we're in has led to people seeking help.
Yeah, that's a good way to put it. Dr. Danielle Harrison, you have been in this very busy, troubling, trying year that we've had, 2020. You've been featured on Lifetime. You've been featured on NPR, multiple
Yeah,
town hall meetings, and most
yeah.
recently, I saw you are the Woman in White Coats Hero of the Year. So congratulations for that.
Oh, yes. Thank you. Thank you. It's been a lot, and I'm happy for this recognition. But you will also notice that I definitely pay it forward. So I'm like, "Hey, you want to interview me? Please talk to one of my residents. Please
Oh,
talk to
wow.
one of my medicine students as well, because yeah, I have to practice self-care and self-preservation, and I want my entire goal in becoming a program director, even though it happened earlier than I thought, is to increase the diversity, increase the number of Black psychiatrists in this country, so that we have a whole gang out here, a whole force
Yes.
who can take over, and I can retire at 40 on an island somewhere.
Goals.
Yeah,
Well, the community definitely thanks you. As we wrap up, anything else that you would like to say to our listeners?
just reach out. We do exist. Black doctors are here. Black psychiatrists are here. We need you. We can support you. We're gonna try. I think even you have to recognize that sometimes you don't get the best answers from some Black physicians, and you just have to understand just the systemic oppression that they've been going through as well. There are so many levels of racism, and everyone doesn't know how to be a mentor. Everyone doesn't know how to be a sponsor or an
Right.
advocate. But do not give up. You are going to find a way. We need you, Dr. Bradley. We need you to keep doing your podcast, to keep making your posts, all of those things, so that we can continue to build and be where we need to be in this system of medicine that we have engaged with.
So well said. Dr. Danielle Harrison, can you drop your socials, let everybody know how they can get in touch with you and follow along?
Yes, they can follow me on Twitter at a doc named Danny. Same thing on Instagram at a doc named Danny. I say anything and everything, so don't be surprised. But I am always here for the culture and for the people. I also have a website that's new, DanielleHairstonMD.com. So you can find me. I'm out here, but you cannot DM me on Twitter because I have to block the haters every day anyway.
Oof.
But that's where you come from.
All right, Dr. Harrison, thank you so much for joining us.
You're welcome. No problem. My pleasure.
The Black Doctors Podcast is a nonprofit, volunteer passion project with the goal of inspiring all who listen. Tune in next week for another episode of the Black Doctors Podcast with Dr. Stephen Bradley, your friendly neighborhood anesthesiologist.